welcome. This is the California Avalanche Workshop 2021. I'm here with SAC board member, Dr. David Fiore. Welcome, David.
Hi. Thanks, David, for having me on.
It's good to have you. We're going to discuss a study that folks who follow the Sierra Avalanche Center may have actually participated in. We shared the request for participation on our website, on our newsletter, and social media last season. And David was this the person on the SAC person sort of in charge of our participation in that. So he's here to tell us about it. Before we jump into that survey, how about you tell us a little bit about your time on the board, how long you've been a part of SAC, maybe why you joined?
Sure, thanks. It's been about a decade. I've kind of lost track about exactly how long it's been, but I got involved. I've been an active backcountry skier for a long time, knew some board members, really wanted to get a Reno presence. I live down in Reno. That was part of it. And then I got interested in both SAC as itself, but also for me, an ability to combine my interest in backcountry skiing and looking at decision making. And that's kind of led into this study we ended up doing. But that's one of the things I really enjoy about being on SAC.
Awesome. I mean, obviously decision making is a huge part of keeping people safe in the backcountry. Like, we're not strictly mathematical creatures that take in the danger and go where we should. We're messy, complex humans. So it's
indeed. And having been guilty of powder fever too often in my life, kind of really wanted to investigate that and look into that and contribute what I could.
Awesome. Cool. Let's maybe transition into the study itself. So you know, you were part of the initial people that were interested in investigating this. Who kind of got all roped in and participated in this study?
So I work at UNR Med School, and as such, I always have a good cadre of students that are interested in doing studies, and they can do a lot of the groundwork. So I had 3 medical students, Esteban Veje, Andrew Coburn, and Spencer Trivet, who worked with me from UNR. And then we were lucky enough to get involved with some people from Montana State, who those in the Avalanche world might know, Jerry Johnson, and especially Jordi Hendricks, who has done a lot of work in the Avalanche world. So we really made this as a collaboration between the 2 universities in order to work on this.
And California Avalanche Workshop followers, you know, will hopefully remember Jordi came out here from Montana, I don't remember, 4 or 5 years ago now, and addressed us back when we were in person on some of his cool work as well. So yeah, you're correct. They're very well known in the Avalanche world.
Yeah, it's great. It's great collaboration, great way to learn from these guys who've been doing it a long time.
All right, and then do you want to sort of take us into the study questions itself, like what was actually being looked into?
Yeah, so if we back up a little bit, COVID hit and a lot of ski areas shut down initially. And then we heard tons about backcountries just swamped. You know, everybody's in the backcountry, couldn't buy backcountry equipment after a while. You couldn't sign up for avalanche courses. And it was a zoo, and the press, even the New York Times wrote about it. So I'm always one that likes to kind of dig in and go, okay, what's the reality here? Can we get some information on this? And then how are the new skiers? Are they different from established skiers? Is there something new going on? So that was really what we wanted to do. And we thought, well, initially we had the students and we were going to stick them out in the cold blizzards and have them stand at the trailhead and, you know, do surveys. Well, with the internet, we decided we can reach a lot more people that way. And we knew there were give and take by going to an internet-based survey. But the numbers were just overwhelming that we knew we could reach. I've done some other internet surveys on rock climbing, on kayaking. So I knew I could reach a lot of people. So that's kind of how it got started. And we thought, let's try and figure out ways of looking at what we ended up calling the COVID cohort, those that started skiing after February of 2020 in the backcountry, compared to people who've been doing it longer. And that was really the birth of this.
I mean, it's a good question to look into. I mean, you're right. I remember, especially, you know, a year ago, essentially in the fall of 2020, in the summer, just as you described, that every meeting I had, if people were asking about the expected, surge of backcountry users and all of that sort of stuff. And it was a question that, reached up to the New York Times. All the local shops were sold out. I mean, my meetings with manufacturers to see if we could get donations, all of that sort of stuff. It was an impressive time. So yeah, it's totally appropriate to investigate how that might contribute or lead into accidents and such in the backcountry as well.
Right. So that was our motivation. And we had some interesting findings. We're still delving into the data, just really getting it ready now. So I don't have answers to everything, but first off, we had almost 5,000 usable responses. We had to get rid of some because they didn't complete, but almost 5,000 responses, about 2/3 men, 1/3 women. And about 15% were what we would call the new COVID cohort. So overwhelmingly established skiers. And that was one of the drawbacks, one of the limitations of our study. We used, as people watching this would know, we use Avalanche centers as a big way of reaching people. We use Avalanche course providers as a big way of reaching people. We use some athletes and some other methods, but those were the two. The Avalanche centers and the Avalanche education providers were our main catchment of getting people. So that obviously biases us towards people who are paying attention to the Avalanche world. We really wanted to try and reach those who maybe didn't really understand the whole Avalanche scenario. And we were limited in our ability to do that. So that's kind of one of our bigger drawbacks.
Yeah, it's understandable, and hitting those people who are not yet part of the sort of larger community is by definition hard if you're part of the community. Yeah, it's definitely
and that's where standing at the trailhead and letting your medical students freeze would have taken care of that bias, but the sample would have been so small. We would have people at a few trailheads, so we didn't feel like that was really, and for the time you put into it, it really wasn't very feasible. But we did find that in general, and we found about 30% of the new users clearly identified COVID as one of the reasons they got into the backcountry. Either they were afraid of getting COVID at the ski resorts, they were frustrated with not knowing how the ski resorts were going to operate, they were frustrated with the way they were operating. Some ski resorts were closed. So a 30% bump basically in those in the backcountry or getting into the backcountry from COVID, I thought was fairly significant. We found that this cohort, not surprisingly, well, let me rephrase that. So we were pleased to find that most of this backcountry had at least, this cohort had at least level 1 Avalanche training. But there was still a larger percentage that didn't have training for this cohort than for more experienced cohorts, which kind of makes sense. They haven't had enough time to get it, even if they wanted it. And some of the places there was just closed, they couldn't get it. But there was a good 25% of this cohort that had no training. We also found this cohort appropriately felt less skilled in judging their ability to assess terrain. And we have some graphics on that that might be worth looking at. And I think that was really great, that they understand their limits. They also identified as less willing to take risks in the backcountry. And I think that's also a positive thing.
Yeah, those are all very interesting findings. I also am sort of putting the mirror up from that to the more established cohort, the folks who were in the backcountry before COVID changed so much. And, I think there has been some research that I think suggests that, while experienced people are quick to point the finger at the inexperienced people as the cause of problems, the data is, I think, suggesting that it's those of us who have experienced and have been doing it a while who are more likely to be in accidents and such. So thinking, once you take a class doesn't mean that you're now given, powers to take more risk, right? It's just our human brains start to bargain and make all these sorts of silly decisions. So it's interesting to just reflect back on those people who are coming in new and how it's different. Their perception is different.
Right. I think that's a great point. We talk a lot about causation and correlation, in medicine. And if you look at this, a very good predictor of whether somebody's going to be in an avalanche is, did they take an avalanche course? Now, I hope that's a correlation, not a causation. It's because, well, who goes into avalanche terrain? People who take avalanche courses, or who takes avalanche courses are people who go into avalanche terrain. And so this little bit of information that we found, I think, helps explain that most new skiers tend to be fairly cautious. And one of the things we're looking at recently is all the avalanche reports that fatalities that happened over the last 2 years. And overwhelmingly, as it is on most years, unfortunately, it's experienced backcountry users. Because we did hear that, oh, it's the newbies that are causing all of these avalanches. And for better or worse, it doesn't really seem to be accurate.
It's especially interesting to have this data and look at what happened last season, since 37 people were killed in the U.S., which is the most in over a decade. There were a couple years that were like 36, very close, but 37 is the most in over a decade. And everyone who was paying attention last year remembers that like 2-week period where there were so many fatalities. It was really awful.
Right. Yeah. So when you do a 1 season or 2 season study on attitudes and behaviors, it's tough because there's all of these co-founders. And yes, last January, February was just, the terrain in many Western states, the avalanche danger was so high. And we think that actually kind of messed up our data a little bit, because we were looking at the effects of COVID, but then we had the effects of this horrible avalanche situation. And actually, we do have some questions on that we're not looking at right now. We're kind of deferring that for another analysis to kind of look at that interaction.
Yeah, it was a double whammy. I mean, everyone was nervous about the increased usage due to COVID. And then throughout much of the West, we had such a dangerous snowpack, and many of the avalanche problems were quite complex avalanche problems. So they should be intimidating for everybody, and especially for newer users. So I can appreciate that is a confounding element in your study.
Yeah. A couple other interesting things we found. A lot of users that responded really talked about seeing more people in the backcountry. And there was an increase in use both of experienced users, about 16%, 13 to 16% increase in proportion of backcountry days. New users, of course, had a much higher percentage of increase in backcountry days, because it went from almost 0 to whatever it went to. So that was not surprising. But one of the phenomenons, and this was maybe a little more anecdotal talking to people, the parking lots were packed. And I think that led to a perception of everybody's in the backcountry. But it was also true, and we didn't measure this, a lot of people were driving solo. So it changed perceptions a little bit. We found that experienced users, as I said, they did go in the backcountry more. We thought they might be going further away from the trailhead to get away from everybody. And they pretty much reported that was not the case, which kind of surprised us a little bit, because some of us at least did experience that. But as a whole, people really stuck to their general patterns and just felt they saw more people around them.
I certainly told myself I was going to go further from the trailhead last year. But then when it comes down to it, there's only so many hours in the day, and there are other responsibilities, and the stuff that is easier and sort of more reliable to fit into my life work schedule. So
right. And that goes into one of these biases we have, habits. We tend to do what we've done before, and that can be very reassuring and very good. But of course, as you know, with avalanche terrain, that also can lead you into, well, I've skied this a lot, it's never slid, so I'll ski it again. And that's one of those heuristic traps we're interested in looking at.
Absolutely. The mountain doesn't know that we're locals or whatever.
Right.
What, so you discussed a couple of your takeaways. Why do you think that this sort of research is important? Why does it matter? Why does it matter?
Right. I think that's a great question. For me, I'm just a curious person, so I love learning things. But when I work with the students, with us, we always think, okay, does this matter to anybody else? What's the importance? I think a big thing we wanted to look at this is these new skiers, new backcountry skiers or riders. Are they different in some way? And if so, how can we use that to reach them and get the message out? we really want to make sure we're starting early, getting people educated to make good decisions. And I think our data is somewhat reassuring in that, showing that they understand they have limited ability to assess terrain. We didn't really go into specifics about avalanche decisions once they're out there. Yordi and his team have done some of that, but I think that's somewhere we could branch off. Our big focus is really looking at, one, just knowing, okay, we heard a lot, there's more skiers. Is that really true? What's going on? Because the sport of backcountry skiing and riding, it's exploded in the last 5 years. So was this just what was going on, or was there an additional bump? And I think we saw that there probably was an additional bump. But more importantly, what can we do with this? How can we help reach people to make sure that we help them make safe decisions? I think that was really our motivation. Nice.
Yeah, as you were discussing that, I was reminded of Yordi's talk when he was at the CAW before. And I if I recall, it was, using GPS, basically asking us to, if we're tracking ourselves anyway through Strava or whatever sort of app we might use, to share that data with them. And then they use that to sort of compare they try to make it like a bit of an objective risk exposure that we were actually doing based on where we actually went with what we tell ourselves and we tell them is our actual risk exposure. And certainly for the experienced folks out there, I think research like that is quite interesting to, get sort of pull back the mist of the kind of, lies or whatever that we tell ourselves, and in that, like, oh, I'm very careful, when in reality I take risks and I just delude myself about that.
Yes, I think it's a great project, and it's fascinating because mostly decision-making studies are done with scenarios on the computer. And I think you pointed out, we all know, well, this is, there's validity to the research, but we all know there's a little bit of a push of, I know what the right decision is. It's hard to get the emotion there of untracked powder to your right, but perhaps less safe terrain and safer terrain to the left, but lots of tracks. On a computer, it's easy to say, oh yeah, I'll ski the safer terrain. But when you're up there, sometimes we don't make that decision.
I also just noticed touring with peers and students in classes or whatever, humans are different, and we just look at the information in front of us in different ways. And so you and I, or us versus 10 other people answering a question in nature where it's complex and there's all those weird factors influencing it, it's hard to sort of pull that out. But if you have the hard data of where you actually go, it helps make it a bit more objective.
It definitely does. I think going forward, that's going to be interesting. I think taking this information we have going forward, and some of the respondents actually gave us their email so we can follow them and gave us permission to reach out to them. It'd be interesting to look at, as they get more experience, how does their decision-making change? And trying to really distill down what factors are leading to that kind of change, because a novice making these decisions that just took a course, they're worried, they're a bit nervous about backcountry. Now they've been doing it for 2 or 3 years. How does their risk assessment change? I think that would be an interesting thing to look at.
Yeah. Yep. I remember having conversations along these lines with a ski patroller who talked about how, rookie patrollers or maybe second-year patrollers are modest and, appropriately afraid of some of the dangerous activities they do. And, 10-year veteran ski patrollers are appropriately respectful and nervous about the risks they do. But there's sometimes a window in between where you get overly confident, overly familiar, and overly comfortable. And, that observation is not directed just at ski patrollers. It's all of us engaged in almost any sort of dangerous activity. And
or complex, I can tell you as physicians, our confidence builds, and then you make a mistake and all of a sudden you're like, whoops, down it goes. And they've shown that admitting people to the emergency room by emergency physicians for chest pain, it's clearly related to when did they last miss a heart attack. That's probably one of the biggest predictors, because that's what life's about, right? You learn, you make a mistake, you get better, and it kind of seesaws up and down.
That's a great anecdote. And, with backcountry travelers, since we often get away with mistakes and there isn't that feedback, it's why, especially this time of year, looking at case studies and learning from examples of folks who didn't get lucky, as we may have, is so helpful to sort of introduce that appropriate respect for the dangers in these activities.
So
Awesome.
true.
David, thanks so much for joining us here. Any closing thoughts or words or study stuff you want to plug?
No, I just want to thank everybody out there who actually responded to our survey. We'll probably in a year or two do another one. I think the internet has really provided us a great way to reach out to people. And I think my next thing is how to reach those that we don't reach through the internet, because as we started this conversation with, really fascinating looking at those people, you know, the quote side country user, the occasional backcountry user. We want to make sure that those people are getting the message. I think the Know Before You Go program and a lot of the Avalanche awareness has really reached a lot of people, and it's been great. But as we know, that's just the beginning. So trying to reach people that we don't normally reach, who might not be watching CAW, is going to be really a challenge, and kind of what I'm looking forward to.
Absolutely. I mean, we just did the budget meeting for the Sierra Avalanche Center, you know, a week or so ago, and you know, we were thinking about how much money do we put towards social media marketing and all these different things. And obviously, you know, the more information that studies like this can provide in terms of where it's most effective is great for guiding those sorts of decisions, so we can, you know, provide life-saving information to as many people as possible.
Right. I guess the last thing I'd like to plug, one of the things I love about the backcountry, and as it gets more crowded, more popular, maybe we see a little less of this, but any sport that isn't real common, you know, there's this camaraderie. And I think that's still true in the backcountry world. And I found I had great mentors, both people I skied with frequently and people I would just bump into. And I just love to encourage all of us when we're out there to talk to each other, and don't be afraid to politely, if you see somebody about to do something that's not maybe too wise, just converse with them. Maybe they'll explain why they think it's a safe choice. But maybe that little question you ask them will be enough for them to think, oh, maybe this isn't what I want to do. I don't think we need to go out there and police everybody and each other, but just having those conversations. I know it saved me in the past from probably some unwise choices. And I think that community is really important.
I agree. I always look forward to the friends that I see at trailheads and stuff like that. Those are good friends.
Yeah.
And friends I don't know yet.
Yeah, friends you're about to make.
Yeah. Awesome.
Cool.
Thank you so much again, David. Here's to a great season.
Yes, indeed. Take care.